Teams are a valuable point of focus for quality improvement in healthcare for several reasons: collaboration, efficiency, innovation, quality of care, patient satisfaction, and continuous improvement. Which is, by focusing on teams, healthcare organizations can harness these benefits to deliver higher quality care, improve patient outcomes, and create a more satisfying work environment for our healthcare providers. If we did not have all these categories, we would not be able to perform or have patient satisfaction. With that being said, that's why it's very important with working in a team, you collaborate and you give proper report when shift change happens, and then make sure, when you do your rounds, you making sure everybody that you are assigned to is taken care of, they're dry, all their dirties are out of their room, like every need for a patient is met. And then also, a team is distinguished as higher performing within a healthcare environment by several key characteristics: active engagement, mutual trust and respect. Mutual trust and respect is where the patient trusts you, and when they talk to you about something that is personal, they are trusting you to keep that information to yourself to a certain extent. Now, if they're like feeling down and depressed and feels like, they're wanting to harm themselves, that is when you would have to break their trust a little bit and say something to a charge nurse or a department head, not to betray the patient, but for their safety. If they are talking about hurting themselves or hurting others. And you have to have effective communication. If you don't have effective communication, you won't build that bond with your patient. And anytime you go in to take care of them or try to meet their needs, they're not going to let you, because they don't have that bond, which means they don't trust you being in there. And if you don't get to know them, or if you don't want them to get to know you, it's going to be hard for them to have that bond. Which means also is enhanced high-performing teams in healthcare are characterized by their collaboration spirit, clear communication, and commitment to continuous improvement. These attributes enable them to provide high-quality care, innovate, and respond effectively to the complexities of patient needs. Team process and roles of individuals with healthcare teams can significantly impact quality assessment in both positive and negative ways. Here's how. Positive impact, effective leadership can guide teams with a clear vision to ensure that team members are working towards common goals and not working against each other, and foster an environment or trust and collaboration. Collaboration and communication are the two number one keys working in healthcare, because if you don't have those, then you cannot perform your job or jobs as a team when it comes to taking care of your patients. Those are too important. A negative impact that it would have is poor leadership may lead to lack of direction, decreased moral and effective team coordination, which compromise the quality of care. You can't compromise the quality of care. It has to be consistent and proficient. If you don't have those, then it's gonna lead to our patients with more bed sores, more skin breakdown. It can cause a lot of health issues, and that's something we want to avoid. We don't want that. Another topic that I want to discuss is The cross-function of a high-performing team enhances its ability to meet the quality improvement goals of healthcare organization in several ways. Is diverse expertise. Cross-functioning teams bring together professionals from various disciplines, each with their own expertise and experience. These diverse allow for more comprehensive approach to patient care and problem solving. Problem solving. That is also important. When there's an issue with, another team member, or, there's an issue with a patient, instead of us, going straight to our charge nurse, we try to figure out a problem solving technique so we can solve the issue and compromise and see if we can work it out ourselves. If that does not work, then you want to go to the charge nurse and be like, look, we tried this and this and this, and it's not working. So, and also being flexible. Flexibility is a high-performing teams are often more adaptable to change. And that's a good thing because you have to be flexible because there's change always going on in the medical field, and it's never the same. Every year we are learning about, new things that scientists has research or doctors have research just in general. And it's very important that we are flexible and able to adapt. Yes, sometimes it is hard to adapt when there is change. Nobody likes change, but sometimes change is is a good thing. And change helps us to build a better bond with our patients and with our team members, and have a better understanding of their the patient's condition or what is going on. The conflict and change are internal elements that can significantly affect the dynamics of a team and its ability to reach undefined goals is conflict. Conflict. The reason why I say that, when a team member has a different opinion or a different vision or perspective on things, it can make it difficult for the team to work together. Because if they're not all on board, then the task is not going to get done. The patient care isn't going to be well. The patient needs won't be met because if we all don't work together and we have that one individual that refuses, it can create a problem. It can. And but the positive impact is a constructive conflict can improve team dynamics as it encourages open communication, active listening, and the innovation. It can also remove barriers caused by different assumptions or misunderstandings. And you're always going to have, misunderstandings. Sometimes, we're not going to always agree on everything, and that's okay. But as long as, we keep, an open mind and stay positive, we can work through it. Now, a negative impact is a prolonged exposure to conflict can lead to increased stress levels and burnout. Like for an example, working doubles back to back, always being at work, overworking yourself to the point where, you end up sick, stuff like that. That can have a negative impact because it can change your attitude and your perspective on things. Like, yes, you have some patients that are really needy, but it's not their fault because, they can't get up and do it themselves. So that's why we come in and, we try to take care of them as best as we can. And sometimes it can be difficult and stressful, but that's okay because as long as we keep an open mind and go in there with a positive attitude, everything will be okay. Change. Like I said previously, change can be the number one impact because nobody likes change. Nobody likes, the new way. We all like the old way. But change is good. Change is, change could be, a better method than the old way was. And by change, by effectively navigating conflict and change, teams can enhance their coherence, adaptability, and overall performance, ultimately contributing to their achievement and defining goals in a healthcare setting. And that is very important. Resources and support that can enhance a team's efforts for continued quality improvement in healthcare include educational resources, quality improvement tools, organizational support, communication platforms, performance and monitoring systems. These team cultures play a significant role in quality improvement by influencing the behavior and attitudes of team members. Like I said, a positive team culture that values collaboration, continuous learning, and patient-centered care and drive quality improvement efforts. If we do not have that, then we cannot do our job in an effective and professional and positive way. Also, it helps the support from the organization, including from leadership, is essential for teams to feel empowered to make changes and strive for improvement. Everybody could use improvement. Nobody's perfect. But a combination of educational resources, quality improvement tools, organizational support, effective communication, and a system of rewards are recognition and significantly enhance a team's efforts towards continuous quality improvement in healthcare. These components work significantly to create an environment where teams are motivated, supported, and equipped to deliver high quality patient care. And that's what that